Hello and welcome to Health Talk. We have with us Dr. Vinayak Senthil, a cardiothoracic and vascular surgeon with us. It's a pleasure to have you with us, doctor. Welcome.
Hello.
So, we know that liver is an important organ now, from what you said. What other organs are people not taking care of when it comes to preventive health, doctor?
Yes, one of the most important things I want to talk about is the renal function test. The renal function test, because any pain anywhere in the body, for a headache or a joint pain, any pain, they go to the over the counter to a medical shop to just take a pill. They want just, I want this, the pain here, pain in the headache and all that. And the shopkeeper gives a pill and they put it across. See, for common ailments and the pain and everything in the body, when you start consuming these drugs, what happens is going to go straight direct affect the kidney. So you need to be very sure that you need to take plenty of water. The recommended water per day is minimum of 3 to 4 liters per day. So minimum of 3 to 4 liters of water you sip in. You keep on sipping in. So you keep on sipping in. It's going to drive all the toxins out. So all the toxins which are going to be the excretes to be excreted, and it be the patients, some ailments could take a lot of medicines. Those medicines can be out by taking more water. So, renal function test can be assessed in a preventive health care with the help of the creatinine, the urea. These two parameters will give how good the kidney function is all about. And also you can measure the GFR. eGFR can be measured with the blood test. So this can give you about the renal function test. An adequate renal function test is very, very important for a healthy lifestyle. And more salt, and again I'm saying more deep fried and salted food, yes, is going to affect the kidney. So everything has to be appropriate level. Everything has to be on a normal level. So anything on a higher quantity, and especially I am talking about for common ailments and the pain and all that, getting on more of medicines into body is going to affect the kidney. Today, very young patients are into dialysis. That is because most of the thing when we see, go back into the history, there are a lot of painkillers, analgesics they have taken that have eventually have given pain relief temporarily and has caused a permanent renal damage. So be thoughtful. If you have severe pain, then take one and stop with that and see why they're the cause of pain and treat that first, rather than just giving medicines and just have a temporary cure and to affect the renal at a later date.
So, renal means kidney, right, doctor? So, how can urine colorations or urine texture help analyze the average person to know whether he should come to the doctor or not? So, how can that be?
Yes. See, when the urine color has to be a straw color. In case it's too yellow, then patient could have been suffer from jaundice, or even too yellow, it could be common, less intake of water. Probably people will have less than a liter of water and the urine will be dark, and it will be dark yellow, and this is the color of the urine. If there are 3 to 4 liters of water is taken per day, then the urine, yes, could have a good flow. It can drain out a lot of toxins and it will be normal. But the indicator is this. The indicator is too much of froth in the urine, in the sink. Yes, there's some protein can go in. So you need to come to the doctor. If there are too much of frequency, mean every 30 minutes or every hour, and the patient is going to go pee and is going to go to the restroom, then he has to say increased frequency. Could be because of a urinary tract infection, or could be because of diabetes, or there is a burning along with urination. Then could be an infection. Go to the doctor. Check the urine test done. So that all this can help you to prevent a major complication coming out of the renal.
And what are other indicative factors that a person can just see in the mirror and know that he should visit a doctor, apart from urine and other?
See, looking at a mirror, how fresh you are, how good you are, how energetic you are, how enthusiastic you are. And the person have a lemon yellow eyes, see the eyes are lemon yellow, then probably you could have a liver problem, could have a jaundice. Or if a patient is pale, looking at a mirror, a man or women looking pale, the tongue looks pale, the eye looks pale, then anemia could be a problem, looking at a mirror. And when looking at a mirror, you feel very tired, could be anemia, could be, and you're not able to walk, you're not able to climb the stairs, you need to check your heart. Yes, so a one herself or himself could look how healthy they are, how energetic they are. If they feel no, something is wrong and my mind is a little fogged, I'm not able to think clearly, I'm very tired, then it's good to go and see a doctor and to get advice from him to get a basic preliminary health check and to know the basic parameters and to know what's happening within them.
So we spoke of what can happen and you miss out on all of these. So what are daily practices a person can follow apart from food habits and exercises a person can follow to make sure that the liver is healthy, the renal functions are good as well?
The most important thing to be healthy is everyday walk in the morning for minimum of 30 to 45 minutes. Get up in the morning, freshen up, go for a walk. And go for a walk with your friends. And when you go with friends, you'll not know the time that it takes for you to walk. And you could share relevant information with your friends. You can share and you can get some information from them. So you have a beautiful, see, that gives us to one is a physical fitness and other is a mental fitness. Being with friends and being with a good group of friends with you. And during a morning walk, you go around and be back. And then what you can do is take plenty of water. And you take one fresh juice in the morning and a fruit juice a day. You look really, and especially the lime juice or a Mozambique juice, that makes you really fresh in the morning. Yes? Then get on to your correct spaced meals. I mean, morning, say 8 to 9 o'clock, you take your breakfast. Or the lunch you take from, say, 1 o'clock to 2 o'clock and the evening 7 to 8 o'clock. You don't skip the timings. Take it appropriate time and take a balanced nutrition. And if you take a balanced nutrition, then to have the exact amount of carbohydrate, the exact amount of protein and the fat with the essential minerals. Yes, that could make your health very good and fit. And also a lot of lifestyle modifications that we'll be talking about later of part of our discussion, and this could make you really, really fit and healthy.
So I think just to summarize, a person should eat healthy, should avoid alcohol at all cost.
At any cost.
At any cost. And also to make sure that he focuses on his LFT, the liver functional test, the renal functional test. And it also matters a person looking in the mirror and seeing what he is. Yes. And I think on further discussions, we can talk about cardiac health. We can also talk about lifestyle modification as you revealed also.
Sure.
So thank you, doctor. We'll continue further episodes.
Thank you.